Hello, I'm Malcolm.
And I'm Janice. When should you have your flu vaccination?
Oh, pretty soon, I would imagine. And when should you teach your children to dance? Next.
On our time. I dance with my grandson now and he's only 10 months old. He loves it. He laughs at me.
Does he?
He does the jig.
You
He can't
also-
walk yet, but he jigs.
Your son was taught to dance quite young too.
Yes, he
eldest.
came to your school.
He did. But that's not what we're here to talk about just yet, because Dr. Kerry's joined us once again with a very important subject.
Welcome.
Hello. Hello. Thanks for having me.
This time of the year,
Yes.
everyone's thinking about winter coming, and should we have vaccination?
The short answer is yes, we should. For the majority of the population, yes.
Why?
Winter is a time where there is increased prevalence of bugs, mainly viruses around.
Yeah.
Often you'll be in the company in the office place, in the workplace, in the schools. Lots of people sniffling, coughing, spluttering, sneezing. Lots of people carrying virus and easily spreading it around. So one way that we can protect ourselves is actually to have vaccination against the common strains of influenza. That's what we have available to us. And for a lot of the population, you can actually have it fully funded by the government, and you can arrange that through your local GP.
But it doesn't cover everything, does it?
It doesn't cover the common cold, Janice,
no.
So there's a whole host of...
Is there a cure for? Is there anything for that?
No, it's basically, there's not a vaccination, there's basically supportive treatment. So you make sure people are staying well hydrated, you make sure that you manage fever appropriately, and make sure that people are not becoming sicker with a complicated
Well, so how
secondary
many people
infection.
think a common cold is the flu?
A lot of people will come into practice, quite typically into your rooms. They've maybe had a bit of a cough, runny nose, perhaps fever as well, and they'll tell you that they've got flu.
Men particularly. I'm dying, I've got the flu. And
We do often see a few cases of typical man flu, but yeah, we need to be careful what we say. So it's not. Some people are genuinely sick when they come to see you.
Should they come to see you?
Yes and no. So if you have got symptoms of cough, runny nose, you can, and sore throat, you can do some simple things in terms of self-care. Importantly, your hand hygiene, hugely important. Be careful where you cough. If you have to cough, try and cough into a tissue, cough into your sleeve, the sort of dab cough that I teach my kids to do. And then obviously try and change your clothes. And that will minimise the transfer of your virus to somebody
But on the other hand,
else.
should they come into a public place to spread their germs around?
No, they shouldn't. But if you have to, then you can do things like wearing a face mask, which you can get quite easily from the chemist or from your GP surgery. Using good hand hygiene techniques, simple hand washing. Very, very sensible, making use of alcohol gel. Lots of places have that readily available as well.
That's what we do in our office. We've got an office and, you know, we've got the Glen 20 spray. If somebody's coughing there, you just go and spray them and have the hands.
But if somebody
obviously.
is sick, then there's an argument that they shouldn't be at their workplace.
No.
They shouldn't be at their school.
Lazy, I'd call them. Lazy. Lazy.
But they could also be putting other people at risk.
Yes,
and you
course.
don't know about the health needs of somebody next to you. You don't know if the person next to you is in the early stages of pregnancy. You don't know if the person sitting opposite you on the train
Well,
is
if I
having
was sitting next to you,
chemotherapy.
I wouldn't
No.
worry about that one moment.
Can we do anything about him? Like,
I think he's
zip
too
it?
far gone.
No, I know.
Too far gone.
Just zip it, will you?
Oh, sorry. We all looked at each other for just that 1 second.
I was waiting. No, I'm telling you to stop and you didn't. Nobody said anything.
Now, all seriousness, we get back to the jab
Flu
in the
vaccination.
arm. Why is it in the arm?
Flu vaccination, because it goes into a muscle. And it goes into a big muscle
I've
group.
got a big muscle down there.
I know, but it's also, there's issues of confidentiality, privacy, patient comfort. Arm is easy, it's accessible, it's nice and quick, easy to monitor for any signs of local reaction. If somebody's just put a needle into your bottom, it's a bit difficult without a mirror or another person for you to check for signs of local reaction.
Well, doesn't that make perfect sense?
It does.
So the flu vaccine is likely to be coming to your local GP surgery just now if the stocks are not already in. It's freely available to certain population groups. Those patients over the age of 65 are entitled to a government-funded vaccine. Young children under the age of 6 are entitled to a government-funded vaccine. That was a new thing that started just in 2018. There are other specific population groups, patients who are asthmatic, patients who are diabetic, patients who've got chronic disease, where the complications of a flu virus could be quite significant for them, higher chances of ending up in hospital, and that's where we sometimes see fatalities in those groups as well.
Oh, gosh.
That's where it's a bit scary, really.
It is.
Yes, absolutely.
Just something that I've always been curious about. Are there good people giving shots and bad people giving shots? Why do some shots actually sting and hurt and some just seem to slide in?
Some vaccines, because of the content of them or the volume of them, they can give you more of a local reaction with pain and things. I was chatting to a friend of mine recently about that who'd had a tetanus vaccine. She was very impressed with herself that she'd gone and put herself forward to her tetanus and her whooping cough vaccine updated with her daughter, who needed to have it done for going to high school. She just had missed a vaccine. And she went on and on about it was the most painful thing she'd ever had, and she was still holding her arm, 4 days later.
No.
Is that overdoing it a bit, do you think?
Maybe.
I think just a tad she was playing on it. But, some injections are uncomfortable, some are very painful. I remember having the swine flu vaccination back in 2009, it would have been, because there was a lot of swine flu in the United Kingdom. We were still living there at the time, and I'd just recently had a baby. So they were vaccinating all pregnant and new mums. So I had the swine flu vaccine. I remember my arm being swollen for about a week and a half.
Oh, gosh.
But generally speaking, vaccines are very simple, straightforward. Yes, we do see a small number of reported reactions to vaccinations. Sometimes that can be predicted, sometimes it's less predictable, but there's monitoring available for all of these things.
Well, for those who don't really understand what a vaccine is, what is a vaccine? What's in the vaccine?
Depending on what you are vaccinating against, for example, you will have a chemical component in the flu vaccine that is able to block the virus of the flu. So last year's flu vaccines, there were different types. There was a vaccination with that covered 3 different forms of flu and a vaccination that covered 4 different forms of flu. And it doesn't always stop you from getting the virus, but your body has then developed antibodies to the virus, so almost like a protein that can then go, when the virus is in your body, it can then go and attack that protein so that you don't get the same level of effect.
And really, you're recommending everyone more or less?
Oh, I think if you think of the younger population, if you've got kids who are at school, they're bound to come into contact with lots and lots of other children who will be coughing and spluttering.
And who won't have washed their hands.
I had a conversation with my daughter about that. And they're maybe too busy at lunchtime to go wash their hands, and they're eating, and there's hand-to-mouth contact, there's hand-to-nose contact all the time. So children should be vaccinated against the flu. If you are working in a bigger workplace, again, you're coming into contact with lots of different people. If you travel by public transport, you're coming into contact. So it's really about protecting yourself, but there's also a small number of people who are not able to have vaccinations, people who are maybe too unwell to have vaccinations.
Because that's too much of a shock.
Maybe because of certain medications that they're taking.
Okay. And that would nullify the medication?
They would be more likely to get complications, and there can be interactions between certain medications.
Right.
So there's people who are, say, on active cancer treatment that are not able to have certain vaccinations. Those people cannot be immunised. If you think of a small child or a young child who's maybe got leukemia who cannot be immunised, we've got a sort of duty of care as a population to try and give as much protection as we can. So if we ourselves are immunised, we're less likely to be going about our day-to-day with active virus.
So I guess you have to have everything.
Yeah, pretty much, and have it updated quite regularly. Yeah.
And who injects you?
The last vaccine I got was given by one of the wonderful practice nurses at my clinic. I got an update for my tetanus and my whooping cough I think it was in December. and done and dusted.
Yeah, I
back
had
to
my
work.
tetanus because of my grandson coming along while Susie was.
So
I had to have the
like
tetanus.
to update the whooping. It's more the whooping cough
Yeah,
component
there's a
of
couple.
the vaccine.
Yeah.
So the whooping cough vaccine can be linked with the tetanus vaccine in one vial.
Yeah.
So you're only getting one needle.
Yeah.
And because we are concerned about the sort of seriousness of whooping cough infection in small babies, the grandparent population quite commonly carry quite commonly will be carriers of the whooping cough pertussis.
Oh dear, there's so much to learn in so little time.
Just.
How do you retain all this?
Lots of updates and education.
That's what I was going to say.
But she lives with it every day. That's probably what she does.
But you've got to keep on top of all this, don't you?
Yeah, you do. And so there's guidelines that we go by that are updated regularly. You try and keep in touch with your the Royal College of GPs publishes educational information all the time. There's also online teaching and education that you can do, and there's lots of other groups that deliver health education to GPs and other clinicians as well.
Gosh, so you're still learning then?
Every day is a school
time.
day. Yeah, literally, you can see something. You can see something different. I saw something a number of weeks ago that I've only read about, and never thought that I would see a case of rheumatic fever in a non-Indigenous young girl in Australia.
Wow.
Yeah. And I sent her to hospital thinking that the other doctors at ED would laugh at my big long referral letter.
Amazing.
And no, indeed, she did have rheumatic fever. So you will never cease to be amazed as a general practitioner. You're always seeing something that is new.
Well, thank you, Kerry, once again.
You're very
Some
welcome.
good advice.
Thank you.
Can you stay for one more minute?
Yes.
And we're about to find out when you should learn to dance.
Any time is a good time.
Well, now's a good time, but don't go too far. So let me pose a question.
Ooh, okay.
So what age do you think you should take your child to anything, like dance classes, swimming lessons?
Early. Well,
lessons?
Harry, my little grandson, is 10 months old and he's started swimming lessons recently. He's a little tadpole.
Oh, really?
Yeah.
Fantastic. Well,
I think the earlier the better, really, isn't it, for anything? Kelly?
probably. Kelly Gogler is with us. Kelly, welcome.
Thank you.
You are a dance teacher.
I am.
You have a Bachelor of Early Childhood Learning.
Education, yes.
Yeah,
And a Bachelor of Dance Performance.
and you're also a school teacher.
Yes.
And you also teach dance.
Yes.
To all sorts of ages.
Busy.
Yes.
And you have 2 children.
Yes.
And a husband look after it?
Yes.
Or does he look after you because you're too busy?
Because
Share it? Nothing to do with the subject. So when is it too soon? Is it too soon? When is a good time?
it's never too soon. It's never too
So
soon.
how do you pick up that your child would want to do something like that?
As soon as you can... I watched my daughter when she was growing up. Probably from at least 8 weeks, you could see her just moving to music, or she would kick her legs, or she would... I believe that...
time to the music?
Yeah.
Okay.
And because I have taught dance for such a long time, I remember just being a little bit blown away, being able to go, wow, okay, they really do. And I guess part of my training, I've learnt that a child from birth will respond to a heartbeat. So they've come already hearing rhythm, and it's the rhythm that will calm them and will settle them, and they'll be able to stay grounded. So
Actually, that's interesting, isn't it?
Yeah.
The heartbeat thing, because I've heard that talked about a lot in a lot of different instances, but I never put it to rhythm and dance.
Music.
Yeah.
No, it makes sense.
yeah,
So what's the first sort of signs, apart from that, that a child has the ability to do this? Because I guess it's sort of in all of us, really, isn't it?
it is. I believe I started the classes with my daughter when she was 10 months old.
Oh, hang on, didn't you start classes when just after, baby wearing classes?
That came just a little bit after.
Oh, okay.
Yes.
Well, after she was born.
Well, after she was born, but I started the classes first, and then baby wearing became a little bit popular.
And that's sort of everywhere now, isn't it?
That is everywhere.
And why is that good?
Sorry, can you just tell us what baby wearing means?
You wear your baby.
No, but I know what it means. But for those that don't, so you wear these like a little like carry thing on the front of you.
Papoose.
So yeah, well that's
Is it a papoose?
something like that.
It's a baby carrier.
Baby carrier. That's what
Depends
it's
where you
called.
come
It's a
from, I
baby
suppose.
carrier. It gives you the ability to go hands-free. You know, I guess it started, you know, being able to do the housework, dancing around the house, bonding with your baby, keeping them close to your heart, keeping them there.
Yeah.
A lot of settling also. Yeah.
That heartbeat thing again, I suppose.
The heartbeat thing again, yeah, just having them there. So I was teaching some baby wearing dance classes.
And is that as good for the mum as it is as the baby?
Yeah, those were more about the mother.
Yep.
Just getting the mum out and about, finding a wonderful community, going and have a coffee afterwards. A lot of the time, especially with the first child, parents find themselves just needing to meet new people that are really on that same level where you don't have to explain yourself, you know, because there's a lot of feelings with new parents that you can't really explain. So.
This is something that obviously is bringing new mums and dads too, because dads can do the same.
Yep, 100%.
Together.
Yep.
Is that because we've lost some sort of community spirit, do you think, that we don't get together like we used to, and the new generation is looking for that coming together?
I think probably it's more that for a mum, a new mum, it's a way of getting out of the house and just sharing.
Oh, thanks for being honest.
No, it is, isn't it?
Yeah.
No, really.
Yeah.
Just to be able to share what you're going through with other mums, not feeling like anything that's happening, you're on your own.
Yeah.
You know, it is that you can talk.
Yeah.
Not so much that we've lost it. I think it's always been there, but this is something, I think it's a great thing that you
More
do.
structure.
Yeah, it's
So,
fantastic.
mums and dads bring their kids along, and do they stay with the children, or do you just have to
In the
look after
dance
them?
classes, yeah, and often it's actually the grandparents that bring the children as
okay.
well. So
Because they're available during the daytime?
yeah, a lot of the grandparents do look after the children while their parents go to work. But yeah, so I have all the parents in the room. There's maybe one that will choose to leave.
Does that distract the kids, or do they sort of
No.
let the parents go and all come together?
Depending on the age level, if they're quite young, or depending if they've come a few times or if it's their first session, I encourage the parents to get up and join in. Some of my classes, I'll have all of them joining in, just
Right.
dancing with their children. So I encourage as much as possible, but to actually sort of feed off your child. So if it looks like, well, they just want to be by your side, I grab them up.
We got some pictures here of children doing the classes, and I noticed that in some of the classes, well, they're doing a performance or something there, aren't they?
Yeah, I love putting them on the stage. Often they will see the stage and they just want to go up there. Yeah, but in all of my classes...
They're all dressed up.
They are. I love using props. So I find the song and then I choose something that will go with it.
Well, we all dress. We love dress. All kids love dressing up.
Yeah, we love it.
Oh,
That's
is that your
your-
daughter?
This is my daughter, yes. This is at least a year ago. We were getting ready before class.
Is she taking a photo of herself while you're taking a photo of her?
Mirrors are fantastic. Children love watching themselves in the mirror.
They're cute.
They are. This
Now,
is another
I'm worried
one.
about this child. She has an issue there, I think.
She has grown a dinosaur tail.
She has.
Sometimes it's a crocodile, depending on where we're at.
Okay.
Which
yes.
song you're playing.
So are they mostly girls, or do boys come along too?
And sometimes I have 50-50. So, yeah, I've got quite a lot of boys that come along. The parents are wonderful. I have boys dress up. I have girls dress up. I encourage whatever they feel comfortable in.
Dressing the boys
Do you
can
know-
dress in tutus if they like.
Yeah, I do. I actually do have a little boy that he comes along in his leotard and his skirt because he just wants to be like his big sister. And he's
Thanks.
just delicious, absolutely delicious.
Wonderful.
Do you know,
Love it.
as we know, and you too, we've been performers all of our lives. I didn't have the opportunity to learn to dance as a small kid.
No.
I didn't start doing dance classes till I was in my early 20s, which was extraordinarily late. So I was never a fantastic dancer. But the advantage I see in boys learning to dance is even if they go on to play footy or whatever, their flexibility is already there. They have that muscle memory of how to stretch their legs, you know, how to push that little bit harder to do whatever they want.
Yeah.
Would you agree?
100%.
So why do you reckon a lot of parents don't bring boys to classes? Do you think dads are a bit unsure?
Yeah. If out of the two parents, it will be the dad that says, "Oh no, my boy can't do that."
But listen, every human being wants to dance to music.
Yeah.
When you're going out, when you start dating or whatever, where do you go? You don't want to just stand on a dance floor and do that to the rhythm.
Yeah.
To be able to have some sort of coordination is so good.
Yeah.
I think, you know, for my son Adam, I mean, he wanted, because you had Tina as a teacher and it was his Auntie Tina, I want Auntie Tina to teach me how to dance, and he would have been 8 at the time. We've still got his tap shoes. But I reckon that helped his confidence too, and it helped. He was the only boy in that class. He plays basketball now, he's 6'5", but I think it did help with his coordination and the fact that he has that rhythm. You know, he learnt that from a young age, whereas some boys don't get it.
Well, some people have got those things naturally and others don't.
No,
that's the thing.
right.
Have you seen that? Some kids just take to wanting to and pick up stuff real quick, and others don't.
Yeah, I think
that's boys and girls.
Yeah, boys and girls, 100%. I think for the young age, confidence is the big one that we try to bring out.
Yeah.
But just even looking at the gender, I was just reading an article about yoga being brought into the fire department and the police department, looking at the stretching, but looking at mindfulness practices that they can use in.
Difficult situations.
Yeah, very difficult situations. So,
But so you're not doing ballet as such.
No.
What are you doing? How would you describe it?
Movement to music. So, especially with the younger ones, I encourage them to feel and respond to the music. We do use interactive props, whether it's ribbons or shakers or streamers. But yeah, I will demonstrate different things, but a lot of the time, depending on the song that I've chosen, I will actually sometimes copy the children. I love watching what they can bring first, and I say,
and what they can do, I suppose.
What they can do. I've got some really cool little hip-hop, little 2-year-olds. They're very cute. They're very cute.
But jumping to the other end, you're also a tap teacher.
Yes.
What makes somebody be able to move their feet like a drummer? Because that's sort of what it's like, isn't it? Because a drummer is working all over, you know, both hands are going, both feet are going. And tapping is finding all those positions on your feet.
Yeah.
What gives you that ability, do you think, to tap?
I'm not really
Make it a
sure.
quick answer.
Quick answer. Tapping, rhythm, beat.
It's in us all.
Yeah. Yeah.
It's sort of plugging together those rhythms in our brain, I guess.
And jumping up and down.
And jumping
noise.
up and down, yes.
Oh, kids love to make the noise.
Kids love to make noise, and we do that. We just need to learn when to stop to make the noise.
Yeah, thanks, Kelly.
Thank you.
Thank you.
Yeah,
I hope that's given you some information about your kids, and we'll be back to say goodbye with the doctor in a moment. You thinking of taking up dancing?
Well, not
Too late.
No, not at the moment. I
Kelly.
wasn't, Kelly, sorry.
Kelly, so what age do you think mums and dads should bring their kids in to learn to dance?
We'd love to be seeing them from any time, as soon as they can interact. So from about 10 months of age is perfect.
So it really helps them integrate as well.
Yeah, and it's just a nice community feel, bringing the parents out as well, meeting some new people, so...
Yeah. Should they all wear a mask so they don't get a cold?
It depends if you're taking your little ones out and they have a cold. In the winter season, it's just really important to keep yourselves as healthy as you can. Be mindful of your hand hygiene and be mindful of those around you, especially the vulnerable groups like the small children.
But if it's just a sneeze or a cough, should you keep them at home, or should you help them understand how to cope with those things?
A sneeze or a cough, if your child's able to make appropriate use of tissues and appropriate hand washing, then they don't need to be confined to the house, so long as they're a well child. If they've got fever or they're off their food or they're lethargic, then they really need to be seen by their GP.
Or tie them up to the lamppost.
And just,
I think seen by their GP first.
but keep them at home, not tied to the lamppost.
Just a quick question. So what sort of music do kids of that age respond to? Is it anything?
Anything they can bop along to. They do watch a little bit more TV than they probably should, so some of the Disney songs I love to use as well, but just repetition, because every week they come back and they respond to the same songs that you're using, so yeah.
Well, thank you girls very much. Very informative.
Thank you very much again.
Thank you.
I might have to get a flu shot.
I think you
I've
should
actually
your
never had
GP.
one.
see the GP.
I think we discussed this last year.
Ooh. Smack on the hand for you. Don't cough near me.
It's time for us to go. Thank you once again, Kelly.
Thank you.
Dr. Kerry, all the 2 Ks.
See you next time.
Keep yourself nice till then.